Hi, you're here today for pre-op for Dr. Misty Suri's knee surgery. The first thing you're going to receive is you're going to receive a red folder, and inside of it it's going to contain all the important information and documents for your upcoming surgery. We strongly recommend that you read over all of the pieces of paper that are inside the folder because they explain everything you need to know for surgery. One of the sheets you'll find in your packet is going to look like this. You'll have 2 copies of this exact packet. The reason for that is one copy is yours to keep and write on and take notes. The other copy is going to have written on the top, "Bring to surgery." We want you to bring that copy with you on surgery day because Dr. Suri will fill that out after your knee surgery with exactly what he did, and it'll have your post-op instructions on it with all important information for you to follow after surgery. He's going to discuss that sheet with your family member, and that'll go home with you after surgery. So when you come out of Dr. Suri's knee scope procedure, more than likely you'll just have 2 small incisions in front of the knee on both sides of the kneecap, a little bit lower than the kneecap, and those will be stitched up with dissolvable stitches and then covered with a steri strip. You'll never see those dissolvable stitches unless sometimes we need to put a stronger stitch in there to stop bleeding. Then you would get a nylon stitch that you would see with no steri strip on top of it, and we will have to cut that out when you come for your first post-op appointment. Normally though, you'll have dissolvable stitches that you'll never see with a steri strip over the top of them. On top of the steri strips, you're going to have a little yellow square of zero form dressing, and then you're going to have gauze wrap wrapped around your knee. We want you to leave that gauze wrap on your knee and in place for 2 to 3 days after surgery. Don't take it off, don't get it wet. It's going to have a Ted hose compression stocking over the top of it. We want you to leave all that in place for 2 to 3 days. Don't get it wet. You can take the Ted hose stocking off if you want to sponge bathe. On the 2nd or 3rd day, you can unwrap your knee. Once you unwrap your knee, you're going to see those 2 little yellow squares of zero form dressing. You can take those off and throw them away. Leave the steri strips on your knee, which are covering your incisions. And then at that point, we want you to get some waterproof NextCare bandages. So that's right here, waterproof NextCare bandages. You can really get any kind of waterproof bandages. It doesn't have to be NextCare. That's the ones that we use commonly, but you can get any kind of waterproof bandages, and we want you to cover those incisions with the waterproof bandages. Once you do that, then we allow you to shower. But we want those incisions to stay clean and dry for 2 weeks after surgery so no infection or water gets into the incisions and causes problems. If you can't find waterproof bandages or you can't find the right size to fit over your incisions, you can always get clear cooking saran wrap and wrap that around your knee, and you can secure the top and the bottom of the saran wrap with some tape, and then you can shower that way. The cooking saran wrap will help to keep your knee dry. You can also always use the clear cooking saran wrap with the waterproof bandages if you don't trust the waterproof bandages. Always take the cooking saran wrap off once you get out the shower. But we want your incisions to stay covered with a bandage for 2 weeks after surgery, and then we'll let you more than likely shower normally. Also, you will notice that you have some removable sticky 10-unit pads around your knee incision. So you're going to have 2 pads above your kneecap on both sides and 2 pads below your kneecap on both sides. You'll see the wires sticking out from underneath the gauze wrap after surgery. Those wires plug into your TENS unit that you may have been shipped from Zynex, which is our TENS unit company that we use. That device plugs into those electrodes and it sends electrical impulses to the muscles to kind of stimulate the muscles and block them from recognizing pain after surgery. That's an optional device that you can decide if you want to use or not after surgery. You don't have to use it. but we recommend it to help pain control. It's not going to help you magically heal faster or slower. It just helps to control pain. If you don't get the TENS unit device, then when you take your dressing off your knee, you can peel off the sticky pads and just throw them away. Depending on exactly what's done in your surgery will dictate whether you get a knee brace or not after your surgery. If Dr. Suri just does a basic knee scope on your knee where he cleans up some things, including the meniscus in your knee, then you will not have a knee brace on after surgery. You'll just have the ice unit, and you will get either crutches or a walker at the hospital to help assist you in your weight bearing, but you'll be able to put as much weight as you can tolerate on your knee after surgery. So after surgery, your range of motion and your weight bearing on your knee has no restrictions. You can put as much weight on your knee as you can tolerate, and you can bend the knee as you can tolerate. We usually instruct you or advise you to use the crutches or the walker for the first few days, let the knee kind of rest, maybe do some partial weight bearing, and then you can begin to increase the amount of weight on your knee, and you can wean off the crutches or the walker as you can tolerate after surgery. If Dr. Suri performs a meniscus repair procedure during your knee scope, then you will wake up in a knee brace and you will go home with that knee brace. Also, you will have weight-bearing restrictions after surgery, so you will not be able to put full weight on your knee, and that is to allow the meniscus repair to heal. He has to put stitches in your meniscus, and if you put too much weight on your knee, that could impair healing of the meniscus. Your brace will have specific instructions that will be listed on your post-op instruction sheet and discussed with your family. So if your surgery plan is to have a knee scope on your knee, then after surgery, you will more than likely not have a knee brace on, and you will not require one after surgery. You will just have a Ted hose compression stocking in place of my green scrubs, and that'll be on your bare leg with a Polar Care ice unit wrapped around your knee. This Polar Care ice unit will be on and running after your surgery, and you will go home with it. It's a great unit that helps to keep down swelling and pain in your knee. It comes with this ice cube box device that you fill up with ice and water. You take the hose from that device and you plug it in to the tubing coming from the ice pack. It fits in and snaps. Once you do that, then you turn on the unit, which will plug into the wall, and it circulates cold water through the ice pack, so it's like an ice pack that never melts. Because this ice pack will stay cold for long periods of time, we want you using it about 20 to 30 minutes on your knee, and then 20 to 30 minutes off your knee or turned off. Usually I say take it off your knee because it may stay a little damp from the moisture from the coldness in the ice pack. So 20 to 30 minutes on your knee, 20 to 30 minutes off your knee, and you can repeat that as many times as you need to help pain and swelling. It's really important to do this aggressively initially after your surgery because it'll greatly help your symptoms and allow the knee to heal. If you have a meniscus repair surgery, which is where Dr. Suri puts stitches in the meniscus to actually repair it and let it heal, then you may have a knee brace on top of this ice unit. I will let you know if that is a possibility in your surgery plan, but what you will then have is you will have this black hinged knee brace that you'll go home with after surgery, and this will be on your knee. Next, we're going to talk about eating prior to surgery. We're going to call you with an arrival time for your surgery. Whatever time we give you, there's no eating 8 hours prior to that arrival time. This includes gum, hard candy, mints, chewing tobacco, or anything you put in your mouth. Once you're inside of that 8-hour window, you can continue to drink water or clear Gatorade up until 2 hours prior to your arrival time for surgery. We do want you to drink some water or clear Gatorade prior to surgery, because that helps to keep you hydrated, which helps things to go well for surgery. But once you're inside of 2 hours prior to your arrival time, we don't want you to eat or drink anything until after surgery. The next sheet you'll find in your packet of papers will be a sheet that instructs you to call us between 12 p.m. and 4 p.m. the day before surgery to find out your arrival time for surgery. You only have to do that if you do not hear from us by 4 p.m. Otherwise, we will call you the day before surgery between 12 and 4 p.m. to let you know your exact arrival time for surgery. That's because Dr. Suri has some surgeries come and go off of his schedule, so we will finalize the surgery schedule the day before surgery and call you to confirm your arrival time. Your time will likely be early in the morning, sometime between 5:30 and 11:30 a.m. The time that we tell you is very important, and it's important to arrive promptly at that time. We have to prep you and clean you for surgery, and if you arrive late, this could cause a delay in our surgery schedule and could cause your surgery to be delayed, and it could get pushed to the end of our surgery schedule that day. The other thing is we want you to get either Hibiclens cleaning soap, which is a strong antibacterial soap, or Dial antibacterial soap, which you can find at any pharmacy. Both of those soaps can be bought without a prescription. We recommend the Hibiclens, and we want you to shower from the neck down the night before surgery and the morning of surgery to get you as clean as possible. It is important to scrub the surgical area thoroughly, but not too hard to cause abrasions. If you're having shoulder surgery, we expect you to clean under the armpit well. On the day of surgery, after you shower in the morning with the soap, we don't want you to put anything on your body. No deodorant, no body lotion, no cologne, no perfume. We want your skin as clean as possible for surgery. It's important that you remove all jewelry, metal, piercings from your body prior to surgery. If you have a piercing or ring that you cannot remove from your body, it's important that you address that with us or anesthesia prior to surgery. Also, please be careful not to get any cuts or abrasions around your surgery site prior to surgery. I would not shave your surgical extremity. We will do that on the morning of surgery. If you get any new cuts or abrasions around your surgery site, we may have to cancel surgery for risk of infection. In your packet of papers, you will have some information on your TENS unit that will be supplied to you by Zynex Medical. They will call you to let you know that we have sent them a prescription for a TENS unit, and they will want to ship it out to your house. In your packet, you will also find a sheet on how to take pain medicine. It's got some things with examples of how to do it and explains to you how to rotate or alternate your pain medicine. At the bottom, we have an option for severe pain that you can follow if you're taking all the pain medicine as it's prescribed and you're still having severe pain. These options let you do little small increased amounts or frequency of those doses for little short periods of time, so you can always read over that. Some tips are that pain medicine contains Tylenol, and it's also important that you do not exceed 3,000 milligrams of Tylenol in a 24-hour period. That's also at the bottom of this sheet. The next thing you'll notice in your packet is a sheet that goes over warning signs for blood clots after surgery, which are also called DVTs. This sheet goes over signs and symptoms of a blood clot. Surgery puts you at risk for blood clots, and those can occur in any extremity after surgery, your arms or your legs. It's important that you know the signs and symptoms, and if you think you're getting a blood clot after surgery, please call us so we can address those concerns. And if we suspect a blood clot, we will more than likely have to get an ultrasound to rule that out to make sure that you don't have a blood clot. If you can't get in touch with us and you think you're getting one of these, we suggest go to the emergency department. for surgery. It's also your responsibility that if you are over the age of 40, you get surgery clearance from your primary care doctor. We should have instructed you prior to surgery if you needed this or not. If you are instructed to get it, it's your responsibility to get this prior to surgery. And if for some reason you do not have this prior to surgery and we do not have documentation in our office, your surgery procedure will be canceled and delayed until we get it. It's also important to remember to read over the information and the pieces of paper that we have given you prior to surgery. The videos are a good tool to help you get prepared for surgery, but the packet may contain a few small things or some more details that were not discussed in these videos. Between the videos and the information in the packets that we have given you, you will be prepared for surgery and know everything you need to know to have a great outcome after surgery.